makes another guest appearance to deal with the media hype around the coronavirus. But first, we feature these leading medical experts, ignored by the left-wing media, now backing up everything I've said from the beginning.
Okay, should I tell you what I really think?
Please.
I almost never do this. I think what we're seeing is a tsunami of a usually quite mild disease, which is sweeping over Europe, and some countries do this, and some countries do that, and some countries don't do that, and in the end there will be very, very little difference.
And I'm just going to quote Dr. Fauci, Dr. Anthony Fauci, and he's speaking early in March. Quote, I'm quoting him, "The flu has a mortality rate of 0.1%, 0.1%. This," meaning COVID-19, "this has a mortality rate of 10 times that," close quote. And your results say?
It's about the same as the flu on that order.
In Santa Clara County, we realized that the number of infected people is somewhere between 50 and 85 times more compared to what we thought, compared to what had been documented. Immediately, that means that the infection fatality rate, the chance of dying, the probability of dying if you are infected, diminishes by 50 to 85-fold, because the denominator in the calculation becomes 50 to 85-fold bigger. If you take these numbers into account, they suggest that the infection fatality rate for this new coronavirus is likely to be in the same ballpark as seasonal influenza.
So when you say it's a usually quite mild disease, what do you mean by that?
That most people who get it will never even notice they were infected.
So does that mean that you think the actual fatality rate of this disease is much lower than the numbers that have been talked about?
Much, much lower.
So do you have you made any speculations as to what sort of zone the real fatality rate might be in?
I think it will be like a severe influenza season, the same as which would be on an order of 0.1% maybe.
I mean, we're presenting a conservative estimate. I think roughly it's on line with the flu. I guess it could be a little bit more. 1 in 1,000, 2 in 1,000, not 1 in 100, 2 in 100.
What sort of percentage of the population do you think we will discover has had it once we get mass antibody testing in place?
At least half.
In the United Kingdom, or do you mean in Sweden as well?
Both countries.
So that would suggest then, for a country like the UK that has already is heading towards 20,000 deaths, that would suggest that many millions of people have already had it.
Yes.
Jay, the results. I'm quoting from your study, which is available today through medRxiv. Have I got that right? All right. It's available through medRxiv, and I'm quoting, quote, "The population-weighted prevalence of antibodies among those you tested here in Santa Clara County was 2.81%. This implies that the infection is much more widespread than indicated by the number of confirmed cases."
There's about 2 million people in the county. If 4% have evidence of infection, that means that there's about 85 times more people who've had it per person that actually identified having it.
That's the critical finding.
Yeah, and if it's on the low end, it'd be 2.8, it'd be 50 times. So for every single person that the healthcare system in Santa Clara County is identified as having the virus actively in them, there are 50 people out there who had it and that never showed up with a positive test. It's the COVID infection is substantially more common in the population than we realized prior to the study.
What am I most afraid of? It's the dictatorial trends in Eastern Europe, that Orban is now dictator for Hungary forever. There's no finishing date. I think the same is popping up in other countries. It may pop up in more established democracies as well. I think the ramifications can be huge from this.
So the whole sort of rationale for introducing these lockdowns across Europe that has created such a unbelievable side effects and pretty much stopped the whole world in its tracks,
Mm.
you believe is a misguided policy. And do you think it's doing more harm than good?
Yes.
So you think the correct policy from the start, just to get this clear, should have been to shield old and vulnerable groups? Probably
And there we failed. Sweden failed. We were not on our toes enough to really shield the old people. We should have banned visitors earlier.
So at the point we are now, what you're advocating then is we protect those groups better, and as far as the rest of the population is concerned, we just allow it to pass through the population, essentially.
Essentially, yes.
Which is, I mean, I know that it's now
Herd immunity, yes.
That's what's commonly understood by what we call the herd immunity strategy, basically.
Yeah. There are others, it's not just the old and frail. I mean, there are the people that should be protected. But...
Right. So the good news is it's not as deadly as we might have thought. So if 50 people had it for every person that we've identified having it, well, previously we're counting the number of deaths. We divide by the number of people we think have it. And we say, okay, gosh, 1%, 2%, somewhere between 1 and 2% of people who have it die. But if there's 50 people who have had it and cleared it, and that
your test now picks up,
then you get a much lower death rate. Now there's some more nuance to that calculation. It's not worth going too much into. The bottom line is that once you do that nuance, it's probably about as deadly as the flu or a little bit worse per case.